Welcome, everybody. Happy Thursday. Thank you so much for taking the time out of your Thursday afternoons to join us today with our expert panel on the state of childcare in 2022. We have an amazing webinar lined up for you today. We have a lot of really amazing and interesting insights to get through today. Some very important conversations are going to be happening. Thank you so much to everyone for joining us today. Welcome, everybody. Happy Thursday afternoon. If this is your first ever webinar with us, welcome. My name is Maddie and I will be your host for today's webinar, our expert panel on the state of childcare in 2022. A very important topic, very important insights we will be diving into today. We are going to go ahead and get started actually in probably about 1 minute. We have a lot of information to get through today to share with you all, and I want to make sure we have our full hour and maybe even a minute more if we can get it. I just want to give everyone a minute to settle in, find a nice quiet space if there is one. I know those are hard to come by in childcare. If you're in an office, close your office door, grab some water, grab some tea. We'll go ahead and get started in just a minute. Welcome, everybody. So lovely to see you all. As always, if you're just joining us, let us know in the chat where you are joining us from today. I hope you're all having a very sunny day like we are having here in Toronto. We are finally having some almost summer level weather, and it's very exciting. Welcome, everybody. Happy Thursday. Thank you so much for taking the time out of your very busy schedules to be here with us, to sit and to learn. Welcome to our webinar on our expert panel, The State of Childcare in 2022. I am so excited. Welcome, everybody. Settle in, close those office doors, grab a coffee, tea, water, whatever it is you need to enjoy this next hour together. And we will go ahead and get started. As always, as you settle in, as you pop into the Zoom, go ahead and let us know where you are joining us from today. Let us know if this is your first webinar with us. If it is, I'm so excited you've made your way here. Welcome, everybody. Barbados, Winnipeg, Calgary, San Diego. Thank you so much, everybody. Okay. I am going to go ahead and pause our music so we can go ahead and get started. Everybody, welcome. Happy Thursday afternoon. For those of you who have never met me before, my name is Maddie and I am the host of our Hi Mama Helps webinars. Thank you for joining our webinar today, our expert panel on the state of childcare in 2022. I'm so excited to dive into this with you today. First things first, something new we are doing that we're so excited about is that every single time that you register for a webinar and you show up live like you are doing today, you will automatically be entered for a chance to win a $50 gift card for resources in your center, in your classroom, whatever it may be. So keep an eye out in our show notes email that you will get by early next week. Don't worry if you don't see it today or tomorrow. Early next week, we will get that to you and we will announce the winner in that email. So make sure you open up that email and take a peek at who the winner is. And as always, before we dive in, we do want to get started with a quick disclaimer. So if this is your first webinar with us, we do just want to be clear that the content we are sharing today is not personalized legal or financial advice for your center. The goal today is for you to take away some very important learnings, some tips, tricks, and techniques for you to bring into your centers, into your classrooms, and into your homes. If you are looking at making any big changes at your center, we do just want to be sure that you are consulting the right people, such as a legal or a financial advisor. And we're now going to give a quick listen to our land acknowledgement.
Hi Mama acknowledges that our main headquarters is situated in Toronto, Ontario, on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. Toronto itself is a word that originates from the Mohawk word takaranto, meaning the place in the water where the trees are standing. As participants and guests in today's webinar, we are coming together from many different places around the world. We encourage you to learn about and acknowledge the land from which you participate.
And we are now going to give a listen to our diversity and inclusion statement as well.
Hi Mama is committed to fostering an inclusive and welcoming environment for our employees, customers, and community. Hi Mama welcomes and celebrates individuals of all backgrounds, orientations, and identities. Our Diversity, Inclusion, and Belonging Committee aims to ensure we provide a safe environment for everyone to thrive while bringing their authentic selves to work. Our mission is to promote an inclusive workspace for all employees through education, discussion, and celebration of our differences. Embracing these differences while coming together with a common purpose is what makes our team extra special.
And a few housekeeping pieces as well. As always, we are recording today's session. So if anything does come up and you do have to pop off, we hope you don't, but we understand that happens. So do not worry. We are recording and we will send out the recording with our show notes email by early next week. We are also recording with the closed caption enabled, so that will be on the recording. If you do require the closed captions for today's presentation, please be sure to hit that CC tab on your side of the Zoom. And certificate, again, for everyone joining us live here today at the webinar, you will all be receiving a certificate of participation for taking the time out of your busy days to be here with us. We will get those certificates out to you by early next week. So again, don't worry if you don't see it today or tomorrow, we will get those to you by early next week. And lastly, if you're having any issues at all with your Zoom, we certainly hope you don't, but if you do, we just want to make sure you're consulting the right people who can help you out as quickly as possible. And that is the support team over at Zoom. So you can reach them at support.zoom.us. Okay, and hi, Mama. If you've never heard of us before, welcome. Let me know in the chat here. Have you heard about Hi Mama before? Is this your first time joining one of our webinars? If so, welcome. I am so excited that you found your way to us. Jamie Andrews, you use us. Amazing. So happy to hear that. We love seeing our Hi Mama family in the webinars. If you didn't know, on top of our amazing professional development community with webinars and podcasts, we are also a childcare management app. So we help centers provide the highest quality educational experience you possibly can. And we help directors and administrators streamline all those administrative tasks from attendance, parent communication, daily reports, photo and video sharing, all of your billing needs. You can do all of that in Hi Mama. If you would like to learn more about how Hi Mama can support you at your center, Lena has posted a link in the chat, so please do feel free to check us out and get a free tour of Hi Mama. And please know, if you do join the Hi Mama family, I promise you, you will receive world-class support. I used to be on our customer success team as well. So I can absolutely say from firsthand experience, it is a fabulous group of humans on the other side of the phone waiting to help you out and make this change at your center. And if you didn't know, on top of our weekly webinars, we also have weekly podcasts that go out. We have hundreds of activities to help support you and your educators at your centers. We have weekly articles that go out as well. And also, if you didn't know, we are a B certified company. So what this means that here at Hi Mama, as we actively work with our amazing group of educators, we are also actively working to make a positive contribution in the early childhood education space. Okay, and finally, your host, welcome. If you've never met me before, again, my name's Maddie. I am a customer advocacy specialist here at Hi Mama. I am your host of our Hi Mama Helps webinars, and I'm also one of the early childhood educators here on the team. And we do have, as always, my lovely co-host, Lena. Lena, welcome. Thank you so much for being here with us today. Lena, what's going on in your world? Any fun facts to share today?
Hi everyone. This weekend actually, I don't know if there's any Marvel fans in the chat, but I'm hoping to go see the new Marvel movie for Doctor Strange. So I'm very excited for that.
Oh, very exciting. Let us know in the chat if you're a Marvel fan. That's a lot of fun, Lena. Thank you. Oh, it was awesome. Lena, you're in for a treat. Okay, and finally, so today we are talking about our 2021-2022 benchmark report. We are going through with our expert panel on the industry insights that they have gathered today. And if you would like to read more or have this benchmark report accessible to you, please do download it. Lena has posted a link in the chat so you can access it and have your own copy as well. Finally, last but absolutely not least, we have our special guests today. Welcome. We have Dr. Calvin Moore. We have Cindy Lehnhoff. And I want to make sure it's not missed there. We have the fabulous Andrew Roszak. Welcome, welcome, welcome. I am so excited for all of you to be here. Cindy and Dr. Moore, please go ahead. You can turn your cameras on now. You can turn your mics on. So excited to be here with you all. Welcome. Welcome. It's so lovely to have you all. I want to make sure I'm not taking up too much of your time. So we are going to dive right in. We will be handing it off to Dr. Moore first to get us started. But right before we do, I just want to let everyone know a little bit about who we surveyed today. Where are we pulling this data from? Who was it who provided this information to us? So firstly, I do want to say thank you to everyone who took the time out of their busy days to participate in our survey. Your information is so valuable to us. We collected over 600 submissions during the final months of 2021 and early 2022. The majority of those we surveyed was directors and owners of childcare centers. And interestingly, we had about 73% of participants were from the US, and the remaining 24 were from Canada. And lastly, before we dive in, and I'll hand it right over to Dr. Moore, I did want to get us started with a nice quote from the CEO of Hi Mama, Ron Spurenberg. Ron said, "Whether you are new to our profession or persevering through this incredible and historic chapter in time, you are part of a community of essential workers carrying out the most noble of vocations, and we couldn't thank you enough." As we dive into this, I just want to echo these words and say thank you to all the educators we have on here for the amazing, incredible, and valuable work that you do. All right, I won't take up any more time. Dr. Moore, I will hand it over to you. Thank you so much for being here.
Thank you, Maddie, and I'm so glad to be here with Andrew and Cindy, and I'm happy to meet Lena as well. Welcome to all of you. I'm so excited to talk to you a little bit about some of the data that I think is important to me as a practitioner and to the Council for Professional Recognition. And I'm sure these first two sections that I'll cover is important to you as well. Enrollment and staffing. You know, this is the bread and butter of any organization. And what we found out from the data from the benchmark report is that in 2022, the average enrollment or occupancy rate for the centers across the data pool was about 59%. That has improved somewhat in 2021, where 30% of the respondents said that they were over 90% enrolled, and another 14% said that they were either 80 or 90% enrolled. And so I'm really excited about the progress that we're making, because you know how important enrollment is. 11% of our centers surveyed that they are still 40% under enrolled. And so while we have made some progress, I think there is progress still to be made. And we're certainly looking for solutions to the enrollment crises that really was brought about by the pandemic. Next slide. Staffing is still an issue. If you look at the data, it still continues to be a challenge. 48% of the respondents report to us that they are understaffed. Of course, this is an improvement, but as you know, finding qualified staff is a key concern, particularly to directors when trying to implement a high quality program across the nation and wherever you're serving children. We see that staff turnover and burnout, particularly during a pandemic, has really been an issue that we've been focusing on. Low pay and benefits also continue to be a concern. But in 2022, in 2020, it was important to note that 64% surveyed said that they were understaffed. That has been reduced to 48%, but it's a large enough percentage for us to still be concerned about staffing overall. Next slide. This is an interesting slide because it really shares with us what folks are doing to sort of mitigate some of those challenges. And as you can see from the screen, 63% introduced new programs or some type of engagement with staff to help curtail some of the turnover that centers have been experiencing. And I think that's important to understand that folks are trying to respond to this crisis. Another 62% said that they were looking at ways to improve the employees' experience at their centers, and I think that is key. Anything we can do to build wellness and support for staff really helps with retention. I also think that there have been some stabilization efforts, particularly in the United States, with CCDF funding to support centers to help mitigate some of these challenges. I'm aware of some centers who've used this stabilization fund to do some exciting things with staff, and so that is encouraging. Next slide. Annual salaries for 2022, we see that the average salary last year in 2021, the previous year, was $27,156. That has improved a little bit for 2021. We know that this is still a concern, that on the average, salaries remain between 20 and 30% for the average early childhood practitioner. And we do see that 27% are a little bit above that in the 30,000 and 40,000 range. But it's still a crisis, and it's still something we need to look at because 25% still report that their salary is below the 20,000 threshold. This is incredible when you look at 49% of respondents have an associate's or higher. And I think that's important because I truly believe that salaries and benefits should really compare in some way to the qualifications of those serving our youngest children. Next slide. Likewise, we've seen some improvement over the years for director salaries. In 2020, the average salary was just over $39,000. The educational background of directors remained steady year over year, with 70% of respondents saying that they have an associate's degree or higher. And I think there again, we should be looking at how the director's salary and the salaries of the staff are tracking over time. And we know that in order to retain staff, salary and benefits is a key concern. Now let's look at curriculum and activities. This is the fun part. This is the part where we know you're offering high quality services through curricula and those things that families and their children experience at your centers every day. What we know is that 78% of those use some early childhood curricula in their school settings. I was really amazed and pleasantly surprised to discover that many people are developing a locally designed curricula, which means that you're bringing in the culture and a lot of the things that the families on the ground really want to see in a curricula. 11% use some outside vendor to provide curricula, and then 6% they're implementing a curricula that the administration has in place. If we dive a little deeper in the implementation of a curricula, we see that people really prefer to implement something that they trust, something that they know a little bit about, and a little bit about the curricula provider, where we see that all respondents really prefer to use a curricula that they know a lot about. And when I was implementing a curricula in a preschool classroom, I agree that this trust factor is really important in the childcare space. Collaboration is another key aspect of implementing rich curricula for children and families. And what we see through the data in the benchmark report is that teachers of young children really want to collaborate, and they often are collaborating on the ground with folks right next to them, right? Particularly around best practices. What this says to me and what I get out of this data is that it's important for every early childhood professional to be really high qualified, because 9 times out of 10, you're going to have some questions asked about best practices of the person right next to you, and you need to be able to answer based on theory and practice, and of course, your experience working with young children. To dig a little deeper, we see that 64% of our respondents said that they would appreciate more opportunities to discuss best practices with their peers. I think this really says to us that folks are really busy in classrooms and centers implementing curricula and activities. They don't have a lot of time to collaborate with their peers, and they really crave that collaboration. So we need to find a way to respond to that. Likewise, 69% of the respondents are hoping to be more connected to others in the early childhood community. And so I'm sure that this experience that Hi Mama is providing for us is a way for you to connect to those that are doing the fabulous work that you're doing. And so I see a lot of activity in the chat, because you do crave collaboration with others who are doing the similar work that you're doing. Thanks, Maddie.
Thank you so much, Dr. Moore. Before we dive into operations and revenue with Cindy, I do have just a question for you on some of that information you just shared with us. Dr. Moore, I'm curious about the curriculum piece. Is there any research to show that using a specific curriculum provider, using a niche curriculum, does that support in enhancing children's development in childcare centers?
There's a lot of research out there on curricula development, particularly curricula that has been sort of research-based and scientifically vetted. And I think that's really important, even though I really do favor a locally designed approach or a supplement of rich locally designed activities that go along with the research-based curricula. There was a study that I read recently that was done in 2021 around the effects of preschool curricula, tools of the mind, as a case study. And it talked about how research and scientifically based curricula really helps the program have some immediate effects on children and families that relate to the social emotional development, their self-regulation, and of course, achievement outcomes, which is really why I think programs really think a lot about the curricula that they want to implement locally.
Absolutely. So one really quick follow-up before we hand it off to Cindy. In terms of that then, in terms of the benefits that a curriculum provider can bring, what do you think educators need to see to develop that trust? For those educators there who said, they don't feel much trust in curriculum providers, what do you think they need to see?
I think they need to see that the curricula is really open-ended, that it's not so scripted, but there is an opportunity for them to bring in those key aspects of the curricula that is appreciated by children and families, and of course, those that work at the center. I mean, curricula should be easy to implement. It shouldn't be really scripted, and it should be really dynamic as teachers implement it locally in classrooms. And I think that will help them see themselves in the curricula if they have room to sort of make it more dynamic and fit the children and families they serve.
Absolutely. That's a really great point. And to have trust as well, I would think that they can bring in their strengths and their specialties into their classroom as well. Absolutely. Dr. Moore, thank you so much. That was amazing. I am going to hand it over now to Cindy. Cindy, thank you so much.
Well, thank you, Maddie, and thank you, Dr. Moore, for the valuable insight that you brought into the report. And I would like to just say I am really thrilled to be here today with nearly 500 essential individuals that are providers, advocates, educators, and all of the above. Because one of the messages I love bringing to any audience that I speak to that are filled with the incredibly talented and committed workforce for childcare and early education is you are the most essential workforce, because you are the ones that allow all other workforces to go to work. So without you, there would definitely be a problem that would affect not only our young children and families first and foremost, but it would affect our ability as a nation to thrive economically. So moving on to our next slide, I'd like to talk a little bit about operations and revenue in 2021 and 2022 compared to 2020. First of all, more centers were open for business in 2021 than 2020, even though enrollment for the most part remained under pre-COVID numbers. And one of the reasons that there were more centers open is that we did not have the mandates in 2021 that we had in 2020 that actually required centers in some states to be closed. And then also those that closed thinking that the pandemic would be short-lived, decided to reopen and follow through with some, social distancing and dropping their enrollment by at least 50% to allow for that. In the fall of 2021, more people were going back to work versus 2020. However, childcare centers still struggled with hiring and retaining qualified staff. So this definitely had an impact on the number of children attending centers in many places and is still having that impact. It is estimated that the industry lost about 300,000 or about 1/3 of its workforce. And when I say industry, I'm talking about the licensed childcare community. And they lost their childcare professionals at the beginning of COVID, and that was for many different reasons. Not layoffs, not including, it included layoffs, I'm sorry, but it also included many of our childcare professionals went and stayed home with their own children who were not able to attend public schools and became their coach. And then some that had low immune systems also were afraid to work because we didn't really know how the pandemic was going to affect young children. And unfortunately, approximately 125,000 have never returned. So we're definitely not back to where we were with the number of employees. So let's look a little further into, what our situation has been. There's been a huge ebb and flow in the industry that between these years of 2020 and 2021 because of the pandemic. But one of the more positive aspects of the pandemic, if you can think of it in terms of there being a positive, is that childcare funding and grants in historical amounts of money were provided by the federal government to states to help the very financially fragile childcare industry survive and to keep the infrastructure that we had in place. We had, first of all, we had actually 3 stimulus packages. And the first one was $3.5 billion. And we were pretty happy about that. It was called the CARES Act, but it was not enough to keep us going as the pandemic continued to linger on. So then the Coronavirus Response Act was passed, and that provided an additional $10 billion to the Child Care and Development Block Grant. And keep in mind that with that 10 billion and the 3.5 billion that we had in that first year, which totaled 13.5 billion in the traditional annual budget for the Child Care Development Block Grant, we had only received about between $5 and $6 billion. So we received a significant amount of money to help childcare, and we were very thankful for that. And then in the last stimulus package, the ARP Rescue Plan provided $24 billion in childcare stabilization grants, an additional $15 billion to the Child Care and Development Fund. This is the largest single investment ever made in the United States towards childcare. And unfortunately, it's going to end. And the progress that we have in 2023 is when it will end. Unfortunately, if we aren't able to build upon this, the progress that has been made, and Dr. Moore alluded to this, states passed this money on to the providers and followed the recommendations that were provided on how it was to be spent. And that was to use it towards expenses and also to use it towards staff salaries and benefits, because we do know that that has had a huge effect on people returning to childcare, and also people that were dropping out of childcare even before the pandemic. So we've kind of had a perfect storm that started before the pandemic and was made worse through the pandemic. So I know that we have providers that have provided bonuses to their staff. We know that we have providers that have given significant hourly raises to their staff. There is a concern at this point that those raises will not be able to be maintained after the grant money runs out, because providers will have to go back to paying their former salaries without government assistance, or parents will be charged significantly more. And we know that parents are already paying more to childcare than they are actually rent, or if they were sending their children to an in-state two-year college. So our next slide, revenue and net income growth year over year. For a second year in a row, more centers reported a decline in revenue year over year versus those growing. Again, this is not, a shock. I mean, fortunately, we had 36% that reported growth, but in some cases that may be that they're comparing last year when they were closed, or they are in 2020, they were closed or mandated to operate at 50% by government, state governments, in order to maintain the social distancing required. So I don't think we can be confident in it that this was actual growth, business growth, or new utilization growth. The majority of providers, again, no surprise, also reported a decline in net income year over year of about 33%. And so really those numbers, go very well together because money in, money out. And actually providers got as frugal as they could be until some of the stimulus money was, put into their pockets. The most successful or important factor for center success strategies coming up in 2022 and 2022 is already, in progress, is customer satisfaction. I think that the industry is always concerned about, maintaining their customer base and making sure that their customers, being parents and children, feel safe and loved, and also educated, and safe being the number one. And that still is very much on everyone's mind, is that our environments are safe and will not be, not see outbreaks of COVID, that could cause extreme harm to children and staff and parents. The other issue, of course, is how we are, what we can do to maintain our employees, and also improve upon our education and our programs. And as Dr. Moore said, more of our providers are looking at ways to help employee retention, such as offering benefits. And I think that we are seeing some progress in health benefits and also paid time off. But what we're not seeing in this industry is retirement benefits, and we're not seeing salaries, again, that go back to recognizing the education of the people that are managing and teaching young children in childcare situations. And so it can be pretty tough if the public schools, who are also the K through 12 arena, is feeling the pinch of not enough people entering the field of education for salaries. But if you are a 4-year degreed early childhood educator and you are working in childcare and you're serving lunch and cleaning classrooms and educating children and doing all of those things for half of the pay that you could get going to the public school and teaching K through third grade, even if your heart is with the under kindergarten age, and make double the salary and have a retirement plan and actually only work, about 190 days a year, you may choose that for not only your good health, but also for the health and welfare of your family, especially with the rising cost. Because right now, the raises we're giving people in childcare, it's not even coming close to helping them deal with the economy situation that we have right now, where prices are high and people are paying more for food, gas, and necessities. What are centers planning for 2022? Well, again, no surprise, centers are considering a price increase in 2022, 57%, so over half. And again, not a big surprise because people are already thinking about their increased cost due to our current economy situation. And also they're concerned that they can't take back the hourly wages. They're going to have to increase even more because in spite of the increases in wages, we are still not seeing enough people apply in the industry to fill all the positions that are open. 21% of the centers reported they're adding additional products and services to stand out. And certainly in higher income communities, that, is something that centers do. They have dance classes right there at the center, karate classes, soccer, and they charge an additional amount of money. But at the same time, you've got to be in a higher income area to be able to offer and get parents to pay for those. So something to think about when we already have many of the children that are qualifying for subsidized childcare, only 1 in 6 are served, and a large portion of them live in what is known as a childcare desert, where there are no centers that are able to serve the 0 to 6 age group. And then 17% of the centers are considering expanding their locations. And one of the things we're seeing in the industry is we're seeing franchise growth. There are 3 to 4 major franchise companies that are really promoting growth in childcare and actually building new centers. But again, most of these are in higher income areas. And while that is great, that those communities are going to be served, we're still not able to afford opening childcare centers. It doesn't pay a provider to open a childcare center in a low income area where they would have to actually, it would cost them more to provide the high quality care than they could charge a customer in that income area. So something to think about there. And then 11% of the centers reported we're looking at acquiring new locations. What we are seeing too is we are seeing some of our large companies that are acquiring some of our smaller providers, especially if those providers own, a small group of centers. And so we're seeing growth in larger companies versus, small businesses. And right now, 93% of licensed childcare centers and homes are small business. And so again, it kind of goes back to the community that Dr. Moore was talking about. And some parents really like dealing with, a center that is community-based. And we really should offer parents, multiple choices of high quality that fits their family's needs and demographics. All right, revenue growth strategies. Centers rank the following risk in order of relevance to their organization. Well, I don't think it was any big surprise that the number one risk is financial. I think that's probably the same answer that people might have given even before the pandemic, because again, it's always been a very fragile, business financially. And in spite of the importance of this industry to our nation's economy, we've allowed it to, we've allowed it to be fragile and not really put any type of government investment into it that might help people open more centers and serve more families. And then of course, labor is second. And I think everybody on this call that is a director or an owner knows that labor is the largest percent of the revenue that comes into of the revenue spent. In most cases, it's an average of about 60 cents of every dollar that comes in, which that in comparison to other service industries is, several 100% more. And so the profit line is, again, fragile. And we are going to have to see some government investment that will continue after the stimulus checks to do what we all know needs to be done from years and years of research, and that is to make it equitable, affordable, and accessible for all young children in our nation so that families can go to work and that we can build those bridges and roads. We passed a stimulus or we passed an infrastructure bill in our country to repair things that have been long overdue, but there's a concern that there's not going to be enough workers to do it because we need the human infrastructure. So I really have to reinforce that we need some help with this, and we need for the industry and everybody that works in it and families to let their senators know how important this is, because it's on the table right now. And if we want to have a strong future, we're going to have to make that call or send that email and let them know that we need ongoing financial support for our young children and families. We can talk a little bit about payments. This was interesting to me. In 2020, 55% of the centers charged by the week. So a little over half of our survey participants only continued what has traditionally been charging parents by the week. But in 2021, weekly charging dropped by 37% and monthly charging rose to 45%. And I think that this is definitely a trend we probably will see more of, because one, there's got to be some ability to change how we use our time as providers, owners, and early educators, because we are not staffed in a manner that keeps directors out of classrooms. So this is one way to do that, is to think about, instead of collecting money every week, collect it monthly. Here was another interesting fact, is that cash and checks remain the most common form of payment. And again, that's a pretty cumbersome activity to have to do. Having been a provider in the field for over 40 years myself, and cash and checks were really the only option up until maybe 15 years ago. It's really tough and time consuming to keep up with that. And again, apps like Hi Mama, which could absolutely, cut in half the time someone spends on collecting money and actually having that part of the parent transaction, instead of just talking about their child's day and their child's care and education. So I think we'll see this number hopefully grow, and people will see it as an option, or childcare owners will see it as an option to improve their business. And then there's the percentage of centers receiving subsidized childcare. It dropped from 86% in 2020 to 77% in 2021. And I was really kind of torn with why this might be, But part of the reason might be that in some states, they are not letting parents of that normally would be working in jobs in an income zone that would allow them to actually qualify for subsidized childcare. Some of those parents have not returned to work, and therefore they're not able to access early care and education for their young children, even though the stimulus packages contributed huge amounts of money to allow for more low-income and essential employee children to attend childcare. So I'm not really sure why that dropped, but it could be that it's dropped because people didn't go back to work in some cases in these income areas, and they can't access the money, unfortunately.
Cindy, thank you so much. Before we hand it over to Andy to talk about a very big topic, COVID-19, and that's impact on childcare centers, I do have a quick question for you, Cindy, based on all this information you just shared with us. The point that stood out to me just so intensely is when you said 125,000 educators did not return to the field. That was very powerful. And I'm curious your thoughts on what is the biggest barrier that centers are facing to get educators back? Or in the same breath, what is the biggest barrier educators see why they don't want to return to the field?
Well, one of the things I'm hearing from members of our National Child Care Association is the people, it's emotionally and physically exhausting to manage a classroom of young children. And when you combine that with the mental and physical exhaustion of the pandemic, families were affected, their health was affected, they were afraid of being infected. I mean, it just took its toll on our mental health. And so rather than put themselves at risk for one of the lowest paid jobs, in our economic structure, they could go work at Starbucks and actually make more. And they could also work and achieve some flexibility where they didn't really need childcare if both parents could, work out a schedule that were opposites to each other. We're seeing more of that. And I think that at the beginning of the pandemic, we also, childcare professionals were not included in the essential. We didn't hear about that. And we still don't hear enough about it. We talk about it, but we still are not being as recognized, as the health community. The frontline workers in grocery stores receive more. And again, I'm not saying they aren't important. I'm just saying if you're going to work a job that is not respected, that totally wears you out mentally and physically, almost to the point you can't take care of your own family. And then you make a salary that allows you to be able to collect food stamps and not have a car that runs. Why would you return? It was just, I think it was the last straw.
Yeah, absolutely.
And we've got to change that, but parents can't change that alone. Families can't change it. Providers are not millionaires. They're not, nobody has the ability to change it. But at this point, some additional government funding that goes beyond, a one-time stimulus package.
Yeah, absolutely. In my role, I have the pleasure of speaking with many directors, and so many directors have said, I think our biggest competition is that our educators were making more on EI when they left during COVID, which is pretty powerful. Very important topic. Could definitely keep talking about this for a lot longer, Cindy, but I do want to make sure we give Andy all of his time to discuss COVID-19. So Cindy, thank you so much for all that information. And Andy, I will pass it over to you now.
Yeah, well, thank you so much. It's great to be here with everybody, and really exciting to see so much engagement in the chat box and just overall the energy around the benchmark. It's always fun when the benchmark comes out to see how everybody's doing. And this year, certainly has been challenging, just like the last couple of years. So we're going to look at a couple of COVID-19 specific things that we looked at in the benchmark. If you want to move on to the next slide, we'll take a look at those. And it's interesting, right now we're starting to move past the pandemic phase. Now, does that mean the virus is going to be gone? No, absolutely not. And I know many of you are on the webinar. We've done a couple of them now with the Hi Mama for COVID. And also this week, if you check out the preschool podcast with Ron, I'm on there talking about some of this stuff as well. So no shock to many of you who've been with us before. The pandemic's going to go on for a while as far as COVID goes. But, pandemic is really a term of art that we use in the healthcare sector. So pandemic is really referring to that widespread transmission of a disease. At some point, that's going to stop and that's going to go away. Now, does that mean COVID's going away? No, 100% not. COVID's going to be here for a long time. In fact, if you look at the last pandemic that occurred in 1918, many of you may not even know, but we actually, in our yearly flu shots, we still get a vaccine for the pandemic that happened in 1918. So, a similar thing is probably going to happen, very likely to happen with COVID, where you start seeing not so much boosters, but just seeing that COVID vaccine actually rolled into the yearly vaccine that we get to prevent flu that we've been doing for many, many years as well. So let's look at a couple of interesting data points here on how early childhood programs have really shifted. And I will say, those programs that were nimble, those programs that were innovative, those programs that thought outside the box, obviously they fared very, very well during COVID, as well as could be expected, at least, right? Nobody fared very well, but they certainly rose to the challenge and certainly implemented quickly some very innovative approaches to keep everybody safe, but to allow that learning to continue, which is just so darn important, especially when we're talking about these very first few years of life. So it's interesting to me when we think about most emergencies and disasters, the recovery rate or the reopen rate. So if your program gets hit by a tornado, an earthquake, a fire, a flood, whatever have you, about 40% of businesses close after a disaster. We didn't see that kind of number with COVID. As the slide here indicates, we saw about 53% of programs that had to temporarily close, but many of those programs, I would say the overwhelmingly majority of those programs were able to get back up and running, which is just fantastic. And that, as you know, and as Cindy talked about, gosh, that's what we need for communities. That's what we need for recovery. That's what we need for resilience to get everything back up and running and our quote unquote return to normal. So amazingly, 53% of the programs did have to temporarily close, but we were able to weather that storm. And I think that's very, very important to keep in mind. We also have this kind of weird paradigm here where we've got, children that are being kind of separated from their peers, children that are not going and engaging in in-person events, children that are just limiting kind of their life experiences for the sake of preventing the disease from spreading. But at the same time, we know that there's a trade-off there, right? And as you're seeing in the slide as well, what we've seen, if we measure it back a few years ago, is we are seeing that kids that were born during the pandemic did have a reduction in some of those verbal and motor and even cognitive abilities. So that's something to really keep an eye on. And of course, as early childhood educators, it's going to be incumbent on us to make sure that we're recognizing those gaps and making sure that we get these children up to speed as quickly as we can. And the good thing is children are very, very resilient, as you know. So the more that they start engaging, the more that they resume some normal activities with their peers, the better that's going to be. But as you know, during that under 5 years of age, 1 million synapses a second are being formed, the most important time in our life for our brain development. So making sure these kids catch up to where they should be and making sure that we're tracking that is going to be very, very important as well. Also, a lot of us had to get a crash course on environmental health and public health, didn't we? And I think everybody right now could probably tell me the difference between cleaning and sanitizing and disinfecting, which is not necessarily a bad thing to learn these terms and then to get them integrated so carefully into our programs. Now, obviously, we wish it didn't take a pandemic to do that, but these types of things, these cleaning, these disinfecting, these sanitizing procedures that we've implemented and now learned so darn well over the last couple of years, they're going to continue to pay dividends as we move forward, keeping kids safe, keeping kids healthy, and also keeping your staff safe and healthy, So we're not seeing those increased rates of absenteeism. We're not seeing a bunch of disease being spread. Ultimately, it's going to create a much more healthy environment for everybody. And the survey, we found over 50% of the programs are actually still implementing those policies. So I think that's a really important finding as well. And quite honestly, Maddie, I think if we continue to ask this question going forward, we're going to see a systemic change brought about because of COVID. I know a lot of folks want to get back to normal, but we're really getting back to that new normal. And a lot of things that we did before are kind of being looked at with a different set of eyes just because of the experience we've all went through in the last couple of years. So let's look at a couple of other things on the next slide, please. And we'll look at, are you still practicing those COVID precautions that we've put in place? And yeah, I think a lot of programs are, and we can certainly see that from the data here. And this is going to be important as we continue to see pockets and new variants of the virus prop up. I know there's been some cases in the New York area lately and some down in Florida. We've had these little pockets of resurgence. And again, viruses just love to mutate. So we're going to continue to see this mutation, this evolution of the COVID virus. Maybe it's going to get more infectious. Maybe it'll get less infectious or somewhere in between. That's just the simple life cycle of how a virus works. So there may be times over the next several months that you are forced to step up your cleaning. You are forced to put some masks back on for a temporary time. That you really do want to pay attention to, the safety and healthness and do some safety trainings and screenings like we were before. That's just kind of the nature of living through one of these pandemics and then getting past that pandemic phase. So additional sanitization, 95%, sending kids home when sick. Gosh, I hope we keep that in our repertoire for a long time because that's a really good practice. We always want to be sending sick kids home. Masking of staff, again, I think that's something that's going to kind of ebb and flow here for the next several months, depending on your community transmission rates and depending on what new variants we may see. Health screening was a big deal, initially, but as those variants came out, as the symptoms of the virus or the lack of symptoms sometimes changed, we did find that some of that screening could be a little bit less important than we originally thought, especially when we saw folks that were presenting without, fevers and traditional symptoms. Social distancing and that as well. 84% of centers are still requiring their staff to wear masks. And we are in a really unique spot here just because of the population that we serve. As we're all very much aware, there's not a vaccine for the kids that we serve. And I'm sitting here as a father of a 15-month-old saying, gosh, I wish there was a vaccine, right? My little girl got some because of breast milk and whatnot, but there is not a vaccine that she can go out and readily get. Next slide, please, Maddie. 49% of centers provided remote learning opportunities and 11% still provide these in 2022. Again, just talking to that real massive shift, that innovative approach that many programs took, the ability to kind of think on our feet was really, really important. One of the questions, and I'll put it in the chat just to have you reflect on it, but I'm really curious to think about as we start moving past the pandemic phase. Are we going to start allowing folks back into our buildings and specifically into our classrooms? This is one of the things that we've long advocated against. Like, you don't need a lot of people in your classrooms. You don't need a lot of people coming and going in your building. First off, from a security standpoint, I just like to limit the number of people that are in my building. But second off, also from a health standpoint, if we think about where our youngest spend all their time crawling around on the floors and whatnot, I don't necessarily need parents bringing their dirty shoes and tracking all their stuff into my center and into my program as well. So be curious to think what you're thinking about in terms of that kind of, return. Are you going to let parents come in? Are you going to continue to have them do that transition outside when they're dropping kids off? Are you going to let them come in, maybe a few times a year for special events? Be curious to see how we go as kind of a sector when we think about those things. And the last slide I wanted to just talk about with you today is really looking at what about if this pandemic lasted for another year, right? So the data that shows, I guess on the next slide there, Maddie, the data that shows on a scale of 0 to 10, what is the likelihood that we'd survive another year? It's pretty good. People are feeling pretty darn confident. So I think, overwhelmingly folks are saying, yeah, we've got this. We've learned from this. We've definitely updated our policies and procedures. But at the end of the day, if this did continue, we're here to help. And we are the essential workforce, and we're going to step up, make sure the kids have a safe place to go. And we're going to learn from this and continue to carry on. So really awe-inspiring how fast, how quickly everybody stepped up. Amazing the adaptation that happened to allow early childhood to continue to serve its essential mission. And I think, as Cindy kind of alluded to, we have a real opportunity here. And I know many groups are advocating for this. And up here where I live in Washington, D.C. on the Hill, people are literally yelling down the corridors and blowing trumpets, talking about how darn important that early childhood workforce is, why we are truly the essential workforce, and why that needs to come with increased recognition, but also that increased financial support to make sure that every child has a chance to be the best that they can possibly be. So with that, let me pass it back over to Maddie.
Thank you so much, Andy. That was amazing. I know it's hard to keep an eye on the chat as you're going, but I saw a member of our audience here, Natalie, in the chat there say that it's actually been really interesting to see a decrease in separation anxiety as well with parents dropping off at the door. So I think that's super interesting. Andy, as you know, I have a question for you that I'm super excited about, but I'm just going to go ahead and address the audience quickly before we dive into that. Firstly, a big thank you to all of our presenters. And as we go into our next quick Q&A for Andy there, I do just want to leave everybody as well as we wrap up our presentation on the benchmark report with a quote, again, from Ron Spruenberg, who is the CEO of Hi Mama. Hopefully this benchmark report has helped illuminate some needs and gaps, whether it's curriculum planning, technological aid, or associated retention that will help your business grow. So I certainly hope this has been helpful to everybody on here. As always, we do want to hear from all of you. So I am going to go ahead and launch our questions of the day. We are looking to know today, as you move forward into 2022, what is your strategy at the center? What technology do you use for your operations, curriculum, lesson planning, do you use technology and what for? And are you interested in learning how we can help at Hi Mama to bring in some technological assistance to help with your operations, curriculum and lesson planning, billing and payments, health and safety, parent communication? We can support you with all of that as you go in to your 2022 strategy. And the last question there, just let us know if you are able to submit these certificates to your local licensing agency. All right, Andy, I am back with you here. Quickly, so one thing that I'm super interested in, so we're talking a lot about how a lot of our new practices for cleaning, disinfecting, all of that are staying more prominent at childcare centers. And I'm wondering, is there a correlation between, or let me phrase this correctly. We know that children being exposed to a certain amount of germs, right, helps develop their antibodies so their immune systems can then defend themselves later on. What is the connection? What do you think is going to happen here if we are exposing children to more and more cleaning protocols?
Yeah, it's a great question, and one it's really kind of been on the minds of a lot of folks in the public health circles. So I will say, from a starting point, it's a good thing that we're doing this increased safety, sanitation, cleaning, disinfecting, all that kind of stuff. And we know from research upon research that does keep children healthy. And a really interesting study was done a couple of years ago. And basically what they did is they grabbed a bunch of young kids. They were under the age of 2, and they did an intense 9-month hand washing study with them. So they taught them how to wash their hands. They taught them the proper ways to do it. They made it fun. They sang songs, all that kind of stuff. And in the first 2.5 years of life, the group that participated in this study actually had half as much diarrhea as children that did not receive the study. So, a good thing when we're thinking about young kids, we don't want them to have diarrhea because that can lead to dehydration and a bunch of other stuff. But the more important and the more interesting part of the study is they followed up with these kids about 6 or 7 years later. And so now they're, 5, 7 years old. And guess what? Even at that stage of life, 5 or 7 years later, the children who got hand washing promotion at that early age were still reaching developmental milestones 6 months ahead of their peers. And the reason why? Because they had about half as much absenteeism. They weren't getting sick. Therefore, they didn't have to miss going to childcare. They didn't have to miss going to school. And they were able to hit their milestones, much earlier. So I think that's really important when we think about, just the impact of something silly like washing our hands can do on the development of a child. To your point, Maddie, yes, we have seen a decline in some of the vaccinations outside of COVID vaccines, of course, for little kids. And we know that mixing and mingling and having that interaction does spread some communicable diseases. So I do think when we go back to in person, we are going to see a slight uptick in some of the things, like chicken pox and whatnot that you can get in a congregate setting. But overall, I wouldn't be too worried about, the antibodies and all that kind of stuff. I think the safer you can keep your program, the cleaner you can keep your program, the better you're going to be. Ultimately, the kids are going to crawl around and end up getting into that dirt and eating that dirt and everything anyway, as I found out.
That's
but
true.
Long-term effects, I think this focus on safety and on environmental health is very, very helpful.
Absolutely. Okay, great to know. We'll have to bring you back then in 7 years or so to see what you've learned. Okay. I know we are officially 2 minutes over time, and I really do want to respect everybody's time who is here with us today. We have one final piece here. We are going to hear from each of our experts on the panel today, their words of wisdom for the future of 2022. And we'll start off with you, Dr. Moore.
Thank you, Maddie. I'm so glad to be with you all today. I think I'm encouraged about how resilient our field has been, and I'm also encouraged about the number of folks who participated in this workshop. And so I just want to say, looking ahead, that the council is here. We're here to help and support. And I also want to encourage you to keep learning, because John F. Kennedy said, leadership and learning are indispensable to each other. So anytime Hi Mama is doing a professional development experience, or any other professional development experience that is rich and engaging, I want to encourage you to continue to learn as you lead.
Thank you so much for those words, Dr. Moore. And Cindy. Oh, Cindy, we can't hear you. I'm not sure if you're still muted.
Sorry about that. I
That's
was still
okay.
muted. Again, I've said it, but I would like to just reiterate that the COVID-19 pandemic continues to shine a light on our very, very fragile childcare infrastructure. And where we go from here continues to be heavily debated by our Congress. I would encourage all owners, early educators, parents of young children, and community business leaders to call or email their U.S. legislators, especially their senators now, in support of this funding, because we really need it to make childcare equitable, accessible, and affordable. There is power in numbers, and we have never used it. And therefore, we have never been put, at the front of the line for assistance that will help our workforce, help children they care for, and therefore help our country thrive. And I lived in Oklahoma for 30 years, and I learned a quote from a source of a Native American resource, and Oklahoma is heavily populated with our Native Americans. And it was, what we do today affects the next 7 generations. So I know that what you're doing today is affecting the next 7 generations. But think of the effect that we could actually have if we all said to our senators, we need for you to hear us. We expect for you to hear us. We've elected you to represent us, but they need to hear from enough of us to make a difference. Thank you all very much.
Thank you very much for those words, Cindy. And Andy.
Well, thank you for sticking with us, friends. It's great to be here with you. I mean, I think my big takeaway in looking ahead is that, look, congratulations. You've all done a fantastic job. You're all still standing. We've made it. Things are on the decline, that we have a bright, bright future ahead. I would encourage you to think about and try to capture some of those lessons learned that you've had over the last couple of years. You've dealt with a lot. You've dealt with staffing shortages. You've dealt with government regulations. You've dealt with closures. You've dealt with supply chain issues. You have dealt with a whole bunch of stuff, and communication too, by the way, big part. So capture those lessons learned, figure out what went well, what didn't go so well, but then infuse that knowledge, infuse that wisdom into your emergency preparedness planning, because you know what? Whether it's a fire, a flood, tornado, earthquake, a lot of these things are going to be challenges as well. So I want to see COVID not so much as a negative thing, but I want to look at the positives. I want to capture all the great innovative work that was done. I want to learn about all the things that we did to get us through this and have us come out the other side stronger than ever. But I want to make sure that we apply those lessons so that if we do have to go through an emergency or a crisis again, we're not starting from scratch. We've got a little bit of a plan. We remember what worked well, what didn't go so well, and we know where we need to focus our attention. So I guess congratulations to everybody for making it through. So happy to see you all here today. We really hope the benchmark is something that you'll rely on as a great resource, and look forward to seeing you all again. Stay safe out there.
Andy, thank you so much. Andy, Dr. Moore, Cindy, thank you so much for all your knowledge, your time today, for being such big contributors to our benchmark report and sharing those insights today. We appreciate all of you. That was such a fabulous presentation. And thank you so much for being here with us. Thank you all. Before we wrap up, I want to thank everyone for sticking on for an extra 7 minutes. I know your time is very precious, so thank you for being here. One last reminder to please download our 2021-2022 benchmark report so you can take these learnings from today home with you. And a reminder, please keep an eye out for that show notes email. We will be picking one winner from today's webinar, so keep an eye out for that because it could just be you. What's next? The show notes email with recording and the slides will be sent to you by next week, announcing the winner, and your certificates will be sent to you by next week as well. So please don't worry if you don't see it today or tomorrow. In terms of next week, same time, same place, we will be here, and we certainly hope you will be here as well. We are talking about how to reduce turnover at your childcare center. Very, very important topic as we go deeper into 2022, and you're all focusing on staff retention. Please sign up now. Lena has posted a link in the chat. And last reminder, if you haven't connected with us on our social accounts yet, please do. We have a Circle Time Facebook group so you can share ideas with other educators. I was just in there this morning talking with some other educators about some great springtime activities for your center. And we do have Facebook and Instagram accounts as well, so you can keep up to date with everything we have going on and all the different professional development opportunities. Thank you so much, everybody, for spending time with us, for sticking out these extra minutes today. I appreciate all of you so much. I hope you have a wonderful week, and I hope to see you all next week. Thank you so much, and take care.